Hi, my name is Miranda Talk, and I'm going to be doing a presentation on Thurner syndrome. Thurner syndrome, or MTS, is a rare condition that occurs when the left iliac vein is compressed by the right iliac artery. Some symptoms associated with MTS are pain in the affected limb, swelling, reoccurrence of a blood clot, skin pigment changes, and more. Some patients may even be asymptomatic depending on severity. Treatment for MTS can vary. It is believed for patients who are asymptomatic that the best plan of action is to leave the vein untreated rather than placing a foreign object into the body. If the patient is experiencing pain or other symptoms, then the likely treatment is venoplasty and stenting of the compressed vein, which will allow the compressed vein to remain open. Some complications that may arise from treatment are prolonged bleeding at the access site and rejection of the stent. Case: a 23-year-old patient presented to the lab with swelling and numbness in the affected limb that had been reoccurring off and on for the past 3 years. The patient has a history of DVTs and a stent in the left iliac vein. The studied order was a venous duplex to rule out DVT and SVT. The results for the duplex were negative. The sonographer had asked the patient if they had ever received an ultrasound on her stomach, which she had not. Upon further investigation, the sonographer imaged the source of the problem, which was that the vein had indeed been compressed by the artery proximal to the stent. Due to the sonographer's quick thinking, the patient was able to receive treatment to fix the underlying cause of her issues. In conclusion, as a sonographer, it's important to recognize the differential diagnosis of vascular disease because we may be the key to diagnosing the underlying cause of the patient's symptoms, allowing a patient to receive the treatment they need. Thank you. This image is just showing the compression of the vein. And this image is showing the compression of the vein proximal to where the stent lies. And this is an illustration of Thurner syndrome, of the artery compressing the vein and how a stent will allow the vein to remain open.